Maria, if you have something to add.
Yes, thank you, Katerina, and thank you just very briefly to say, because I think this can be confusing, that there are different types of tests that are used in the fight against COVID-19, and there are these molecular tests, these PCR-based tests, which were rapidly developed very early on in the pandemic due to the fact that we had access to the full genome sequence within days of first being alerted to this cluster of unknown pneumonia in China. And that has been the mainstay of testing across the world. And we're very grateful for all of the national influenza centers and all of the labs across the world who have rapidly increased their capacities to carry out PCR-based testings, which are available. Results can be as quick as hours, but most of the time it takes days to get those results back. There are the antigen-based tests that we're talking about today, these antigen-based RDTs, rapid diagnostic tests, which detect the proteins of the SARS-CoV-2 virus. And these have been in development for many months, but we have the good news today of having one with the EUL listing, but there are more that are under evaluation, and there will be more that will come online. And what is really beneficial about the antigen-based RDTs is that this will be very helpful in situations where there isn't ample access to PCR testing. And WHO issued guidance recently to identify different areas, and this is part of the package that was announced today. There are different settings in which these antigen-based RDTs can be very beneficial. And there's 4 situations where we recommend them to be used, where there's PCR that's not readily available. First is to respond to suspect outbreaks in remote settings or institutions or semi-closed communities where we don't have the access to the PCR. Second is to support outbreak investigations where you have at least one case that you know is detected through PCR. This really helps you do these cluster investigations, these outbreak investigations, to bring them under control. You've heard us talk a lot about the fact that this virus operates in clusters. When it has an opportunity to find individuals in close proximity to one another in closed settings like prisons or long-term living facilities or different types of settings where people are in close contact, these outbreak investigations rely on testing to understand the extent of infection in that outbreak. The third area is to monitor trends and incidents in specific communities in higher risk populations like frontline workers or essential workers, and this will help to monitor if they are infected, and these tests will give rapid results back. And the third is in areas where you have widespread community transmission. Either you know that there's widespread community transmission or you suspect that there is, and again, where you don't have access to that PCR testing. So this will be really, really helpful for communities and countries to be able to know where is the virus, who is infected with the virus, and most importantly, what do we do? What are those public health steps that are needed next once we know that the virus is circulating? This is the case isolation, care, clinical care for cases, contact tracing of close contacts, et cetera, et cetera. So this is a really helpful tool that we have in our toolbox that will help us break chains of transmission.
Anne Gilland from Telegraph. Anne, can you hear me?
Hi, yes. Can you hear me?
Yes, please go ahead.
Okay, great. Thanks so much. Yeah, thanks for taking my question. It was about the testing, and I just wondered, would these rapid tests replace PCR testing, and how do they work in conjunction? Is PCR testing more accurate than these new rapid tests, or is it PCR testing, would that be more likely to stay in a sort of health, more sort of clinical setting like a hospital? Can you just sort of give me a sort of comparison of why you would use PCR over the rapid testing? Thank you.
I'd like to invite Dr. Kerkhoff to take this question.
Thank you for the question. I can start and maybe others would like to supplement. So again, we have these PCR tests that are available all over the world, and every country now has the ability to do PCR testing for COVID-19. Again, we cannot overemphasize enough how incredible this is in this rapid increase in the ability of countries to, one, get access to this test, and two, to have the facilities and the work staff to be able to do that. So many countries are doing the PCR test. The challenge with PCR testing in many countries right now is the turnaround time. There's a cost issue because the antigen-based tests are cheaper, certainly, and they're faster. But for the PCR test, it does take some time in some countries to get those results back. They can be done in hours, but oftentimes the results come back in days. And that poses a challenge to control efforts in the actions that are necessary. The antigen-based tests, which are coming online and more are becoming available and going through this validation and evaluation in this emergency use process, which is a very robust process to check how well they perform. Our understanding of the antigen-based tests, and Katerina, please come in on this because FIND has done a lot of this evaluation, is that they perform best when there's a lot of virus around in the community and when the person has the highest viral load and is the most infectious at the time during their infection. And this is about 2 days before symptom onset to within 5 to 7 days after they develop symptoms during their illness. And so they perform best in those types of situations. And so that's why WHO, when we put out our guidance, we gave these 4 different situations in where they perform the best. So these can be used in conjunction with PCR testing. Having said that, there are many parts of the world that don't have access to rapid turnaround of PCR, or where there are samples that need to be collected from an individual, and those samples actually need to be brought to a lab, a centralized lab somewhere else that could take hours to days to get to, run the test, and then it takes hours to days to get those results back to that individual. Antigen-based tests can be very helpful in these types of situations because you could do them next to the patient, next to the individual, and those results can come back quicker. Now, none of these tests are perfect, but many of them are working, and the companies that are developing these and the labs that are validating these and evaluating these are working very hard to ensure that they perform optimally. And so what we do as WHO, we try to write guidance to show where and when they can be used as part of an algorithm. But we're so grateful to all of our partners that are driving this development forward and really pushing the boundaries of what testing can do. And Katerina mentioned, right now we're using nasopharyngeal swabs, but there's a lot of development of saliva-based tests and other types of tests, and these are coming online. So we are grateful for the advancement of this and the acceleration of that. But there are better places for the PCR test to be used in the antigen-based test, and that's what the WHO guidance has outlined.